In our Be Healthy report, heart malformations are the most common kind of birth defect. In fact, a federal advisory panel recommends that before newborns leave the hospital, they receive a simple, pain-free test to check for signs of congenital heart disease. But not all hospitals administer the test. Here to discuss this issue, Dr. Ted Rosenkrantz. You are a neonatologist and professor of pediatrics at UConn Health Center. Thanks for joining me, doctor.
Well, nice to be here.
So this testing, it's called pulse oximeter testing. Let's talk about that.
Sure. A pulse oximeter is a very simple device. It basically is a very soft, malleable device with light coming out one end and a receiver for the light on the other side. And it allows us to get a very good measurement of the oxygenation in the baby.
So the pro of getting this test is doctors and hospitals can detect a birth defect. So that's a good thing. And the test is, it seems simple, pain-free. So why don't all hospitals do it, though? Well,
it's something that's been a long time coming. Back in 2009, there was a national advisory committee convened by Health and Human Services recommending this to happen, but the Secretary of Health and Human Services felt that there were still some questions that needed to be answered, and specifically how to implement this type of testing so that you had the highest yield, but you didn't have a lot of false positives. In other words, babies who you thought had a disease, the congenital heart disease, but really didn't, so that you weren't alarming parents unnecessarily, and you also weren't overwhelming the pediatric cardiologists with confirmatory tests on babies who didn't need it.
So is there a way to perhaps fine-tune this testing so that way it can be mandatory?
Well, with a paper that will be coming out in Pediatrics, which is one of the main journals for pediatricians, this November, there is a recommendation from the committee that was reconvened, if you will, to look at what type of equipment should be used, when it should be used, what values are, if you will, critical values that people should take notice of, and also how to combine that with the physical examination so that you get the highest yield of true positives and the lowest yield of false positives.
But we should let our viewers know that some hospitals do administer this test, and I'm wondering if the parents could probably say whether they want it or not, whether they want to administer it, right?
Yeah, there are certainly some hospitals, and I know that in New Jersey and Maryland they're about to make this mandatory. There are hospitals around the country that are starting to do it. I don't think that we'll see it widespread until this paper comes out. And there'll still be some kinks, if you will, that'll need to be worked out. For an example, the oxygenation of the baby is very different if they're born at sea level, such as here in Connecticut, but is a bit different if you're up in Denver, Colorado, a mile above sea level. So that has to be worked out. Also knowing how we're going to get from the testing in the hospital to the appropriate referral site where they have a pediatric cardiologist and who can make a confirmatory diagnosis one way or the other. While we in Hartford have a well-integrated system in pediatrics and also newborn screening, that's not true in all parts of the country. So again, one of the hurdles we have to overcome is, well, if you screen one of the babies and you think that they've got a problem, how do you get them to the cardiologist to confirm yes or no whether they have a problem?
I know for some parents this mandatory testing can't come soon enough, but at least it's reassuring to know that steps are being taken so that this can be mandatory.
Absolutely. And it also is a little bit different depending where you are in this country and where you are in the world. Certainly in this part of the country there's a lot of prenatal diagnosis of these critical types of heart problems, and that's not true in other parts of the world. So the yield and how many new babies we may discover in a more timely fashion will vary depending on the environment.
Doctor, thank you so much. I appreciate it.
Well, my pleasure.